Assalamu alaikum everybody, Bismillah ar-Rahman ar-Rahim, and welcome to our webinar tonight, The Future of Healthcare and Islamic Finance. Bring your drinks, get your dinner, come get yourself comfortable, and this will be a nice relaxed discussion between our panel guests today. We have the chat function open for you. If there's any IT or audio issues, please put them into the chat function and they will get dealt with. Or if you have questions for our panel, please also put them in the chat function and I'll bring them to our guests tonight. My name's Dr. Saira Dar. I am a GP. I work in the NHS, but I also work as a private GP for a digital healthcare company, and I have been for the last 8 years. And I've seen the industry grow, expand, change, and adapt. And with that comes many challenges, but also it's very interesting and exciting to see where healthcare is going. I'm also the BIMA president, and with me today I have two amazing guests. I have Dr. Imran Kausar, who is an ex-GP, I don't know if I'm allowed to say that, but also the former VP of Novartis and has many, many years of leadership experience in the health industry. He's the CEO for Haludis and the founder of Deep Health Consulting, where he is helping healthcare leaders navigate a fast-changing landscape due to the acceleration of innovation. We also have Hassan Daher, who is the CEO of Cardis, and Cardis brings Islamic finance solutions and has supported UK-based healthcare businesses to get started, to expand, to improve the medical technology, to stay up to date with innovation so we can do what we do best, and that's bring good patient care and a great patient experience to our patients. So thank you both for joining us today, joining the webinar today. Assalamu alaikum Imran, assalamu alaikum Hassan.
Wa alaikum salam.
Welcome, Sarah. So just a slight correction, Sarah. As much as I love GPs, I was never clever enough to be one. So I just stayed as a humble anaesthetist, but never beyond that.
Apologies, correction. Thank you for correcting me on that. I think just to start off and kind of develop that context of the conversation today, I think we all agree and very much we feel the effects of a healthcare system that's at a critical juncture, a healthcare system that's struggling and facing huge challenges. We are under-resourced in the NHS, there are rising costs, an aging population, which means many more people are living much longer with chronic disease and the chronic disease burden that comes with that. We have workforce shortages as well. And we are increasingly living in a digital world. I'm hoping we can look at some of the solutions that will shape the healthcare industry in the UK in the coming years, some of which has been driven with the need for change, which I've mentioned some of those challenges already. And we will discuss the evolving landscape, the emerging trends, and these solutions. So I'm going to open the floor to Hassan, our CEO from Cardis, to tell us a little bit about what Cardis can offer in this space. Thank you, Hassan.
Yeah, thanks, Dr. Sahira, for the introduction. So, what essentially we're doing at Cardis is we're an Islamic finance provider that specializes in the healthcare sector. So we help healthcare businesses grow, offering them a working capital financing facility of between £50,000 to £500,000. That's unsecured, backed by personal guarantees from the directors. So alhamdulillah, since we launched during the pandemic, we've been helping pharmacies grow initially because they were doing really well during the pandemic. And quickly, we started funding other types of businesses, dental practices, social care homes, and we've been just funding different types of businesses in different sectors. But primarily, our main focus is on healthcare companies. So 40% of the businesses we've funded so far have been in the healthcare space. And we're really, when it comes to funding healthcare companies, we understand them really well. Initially with this working capital financing facility where we've offered, for example, headroom for pharmacies to expand at some point. There was a lot of M&A activity in the pharmacy space. We would come in and offer working capital headroom so these pharmacies can purchase other pharmacies and grow at the same time. So it's been going well, alhamdulillah. And so far, over the last 12 months, we've grown our book by around 2.3 times. And we're very confident about the market even now. and we're looking to help more healthcare businesses grow. And primarily, what I'm curious about for this webinar is just to understand where the pain points are in the healthcare sector and how we could quickly step in to either develop new products or support in any way we can. And one final thing is we've also got an investor platform where investors can basically also generate financial returns by funding these businesses. So that's another aspect of our business, which is more on the crowdfunding peer-to-peer side.
Thank you, Hassan. Imran, can I bring it over to you? That discussion, obviously, Hassan started off telling us what Cardis are doing and that sustainable model that can help healthcare businesses to really come into a space where they might not have had the chance before. How do we incorporate the digital world with an opportunity like that?
Yeah, thanks, Sarah, and salam to everybody. I think the availability of finance will be very helpful to a number of organizations that are looking to adapt or evolve in the current environment. I think most people will have to be living under a rock if they're not aware that AI is now becoming a greater part of life. Probably and possibly many of us use it anyway. Even for a simple search, you'll see an AI generated response. Obviously, in healthcare, there are some additional limits and restrictions on how we can use it because of the passage of personal data. But the point is that those will be overcome in time, and we'll see a significant influx of digital technologies used in everyday medicine. We're already seeing that in some countries. And the types of areas where we're already seeing it is, for example, in areas of diagnosis and screening, where many people will be familiar that AI is now reading certain X-rays or CT scans, and also it's being used in admin and operational areas, making sure that missed appointments don't happen anymore, improving that operational ability there. And we expect to see more in decision support, so assisting with doctors in listening to the patient conversation and then suggesting potential differential diagnoses or suggesting additional tests to do, which could take the burden off doctors as well. And then in future, we expect to see use in risk analysis and prediction, as well as being able to take in information that patients provide us from wearables, etc., to give us a more holistic picture of their overall health picture. These are just things that we can predict and know will come today. And healthcare systems will need to adapt to use these. And some of you might already be using AI tools like Heidi, for example, which will act as a scribe, meaning that you can face the patient instead of facing your screen the entire time, which makes a big difference to the patient's perceived quality of the interaction. But these are not free. Now, some of them are very cheap, and so people may well pay for them just through their own pocket. They're not a big expense. However, as time goes by, we'll expect to see more and more tools come. And then the healthcare system will really have to answer a question, which is, how do we fund all of these? If there's separate algorithms or separate machine learning or AI tools for everything from, listening to your conversation and giving you cardiovascular risk or improving diabetes outcomes, or anything from mental health, this becomes burdensome for the healthcare system. And so decisions will have to be made. And also with data privacy, there'll be issues to concern with regards to where is data going. If there's a scribe that's listening into a conversation, what are the implications and consequences of that potentially identifiable information moving across servers? Most people will be familiar with GDPR in the UK now, but the EU has recently announced an EU AI Act, which started in 2025, which places additional obligations upon developers of AI as well. Those don't currently apply in the UK, but no doubt over time there will be something similar. So the question arises for us to be able to benefit from digital technologies, either to improve our workload, or if we want to make sure that we kind of are offering the best opportunity to our patients, we will have to consider how our practices need to adapt. And it's not obviously just for GPs, although that may well make the bulk of patient encounters, but also within hospitals as well. There needs to be some adjustment made to make sure that these technologies are available. And also, of course, in the community setting, outside of GP surgeries, whether that's remote consultations or in-house consultations or consultations in perhaps a nursing home or something similar. So there are multiple considerations to make. And some of these individuals will be able to fund themselves if a particular healthcare system approves it, whether that's an ICS in England or whether it's a Health Board in Scotland. or if there's funding it themselves, they need to just plan and make sure their investments might deliver return for them.
Imran, you talked a lot about the patient experience and how these tools can enhance patient experience and that interaction between the doctor and the patient. One of the biggest issues patients will talk about, and this is not just in the UK but globally, is the really long waiting times to see a doctor. I mean, we hear all the time, can't get an appointment. And then the other, so that's within the NHS or this sort of system. And then if they want to go private, the cost is a barrier. How can these digital platforms how can they be the solution to those problems?
Yeah, I think equity within healthcare has always been an issue, even within the UK, let alone around the world. And of course, the ability to bring high quality data directly to patients means that it'll make it more accessible to them, because most people around the world, even in countries with lower economic status, are able to, users there are able to access the internet. I mean, most people might not be aware, but ChatGPT is even available via WhatsApp. So you can just WhatsApp it as you would a friend and ask health information there, or any type of information, meaning that the accessibility of these new technologies will positively impact those who are unable to access healthcare, which is obviously a good thing. There are other issues around, well, what do they do with that information? How reliable and transparent or even accurate is it? Is it sensible to be giving personal information to a chatbot or a large language model? And these are things that need to be resolved. But in terms of the actual basics of being able to improve equality in healthcare, definitely that's one of the biggest outcomes. And indeed, if you read the literature about the individuals that came up with large language models and their intent, OpenAI is called open because it intended to be open, although it's not actually open in terms of being able to understand how it comes up with decisions. But one of their intents was to make humanity more equitable with regards to accessing information. There's an adage that within this field that, the Industrial Revolution turned mechanized individuals' hard labor. So no longer did people have to carry bulky things, etc., or undertake arduous processes, because the Industrial Revolution changed that by mechanizing things. The equivalent today is AI, which will take away intellectual labor by making it democratic for everyone. The computing language of the future is no longer Python or C or C++. It's plain English. You can just type into a large language model what you intended to develop, and it will do the heavy lifting. So similarly, when we imagine that in terms of healthcare knowledge, although it can be confined to individuals, for example, within specialties or at a distance, if you consider family practitioners, AI has the absolute ability to make that a lot more equitable for people once language considerations are taken into place. So there absolutely is that opportunity.
I think that aspect of equity and equitable access is really important. And having been working in the NHS for many, many years, when I started working for this private digital healthcare company, I had a bit of a personal issue with it initially, because, and I think a lot of people do, but I've now come to realize that there's a real need for collaboration of that space with the NHS and how they can enhance each other, because the NHS, many services, especially the kind of lifestyle services, are not accessible to everybody. And when you've got a digital platform, it actually allows for equitable access to much larger population, especially around women's health and these sort of lifestyle issues, because the services are not fit for purpose in many regards. So I've definitely found my opinion on that has changed, and there is a space where NHS and private can collaborate, and I think digital healthcare and these digital tools allow for that to happen. Hassan, can you comment on that at all? I mean, Carter's having come into the space pandemic, such a great time, wasn't it? It was good timing.
Yeah.
How can you comment on that sort of collaboration between NHS and private?
Yeah. Definitely. I mean, when it comes to what we're doing, I mean, obviously we're looking at training AI models or AI agents to be able to help us underwrite, for example, on our end. But I mean, we're looking at two trends. First of all, I mean, we've been hearing a lot about at what point will the NHS start to shed some of its infrastructure to the private sector. So that's something I'd like to hear about, in the sense that if you've got all these inefficiencies, basically that are leading to long lead times with patients, at what point, or has it already been the case where discussions are coming up on, okay, how about we privatize, for example, diagnostics and give it to the private sector just because they could probably do it better or reduce the lead times? Or it'll be interesting to understand. I mean, I know I'm rather asking a question, but I mean, it's more about understanding on my end whether you think this is a trend that's going to start to get more and more common, in the sense that the NHS is going to admit it's probably doing a good job in some areas, doing maybe falling back in other areas and deciding to focus, for example, on key areas and subcontracting or privatizing other areas. And that's how I would link what we're doing, in the sense that when we look to support limited companies that have been trading for at least 3 years, that are doing well, that are growing. So the more there is a privatization element, or the more you have entrepreneurs in the healthcare sector, the more likely we are to support them because they fall within our eligibility criteria.
Yeah, I can take that, Sarah. I mean, so yeah, I mean, obviously everyone will be aware there are differences in how the NHS is delivered across the UK, but obviously NHS England, being the largest part of it, over the last 20 years has gradually shrunk from being a healthcare system to an acute care system, meaning it's very specifically over time reduced the number of conditions that it will actively look after, and patients will be frustrated to hear, and GPs will be frustrated to explain that a particular condition is no longer covered by the NHS. And that list of conditions that's no longer covered increases pretty much every year. And then within that, particularly since the advent of ICSs, although it happened before then as well, individual regions may choose to deprioritize or defund certain areas, which means that there's a big opportunity for private healthcare providers, because of course the need doesn't go away. And if the NHS is unable to afford it or fund it, then patients will seek opportunities in other places. Now, clearly, the existing private hospitals are typically well placed to pick those up. But for smaller things or relatively quick things like varicose veins, etc., they're brand new providers that are springing up to be able to offer those. So I think that's one clear area where the NHS is no longer funding things where private providers can have a benefit, or GPs that are willing to provide a particular service, perhaps for cost, are able to do that through some form of mechanism. But I think more broader than that, looking at macro trends, what's also happening is that we have, although we're very familiar with the older patient and the fact that we're seeing more older patients in society who have more complex healthcare needs, which take up a lot of resource from the NHS, there's also an increase in wellness where people are actively wanting to take more care of their health to avoid issues in the future. An area which, other than Public Health England, which is also the former Public Health England, is no longer something that people have an opportunity to really benefit from unless they choose to do it themselves. And beyond specific initiatives like 5 a day or couch to 5K, there are actually relatively few things for patients to do, or not patients, but people who want to take more control. And that's really exploded into a whole new opportunity for private providers, whether that's app-based or whether that's clinic-based. And you see that because most of us on this call will probably have some form of wearable, even if it's by accident because it's our Apple Watch and it's collecting healthcare data, or whether it's purposeful and you're looking for either your genetics or how you respond to, or how your microbiome is doing, or how you respond to certain substrates. And that is only ever going to grow. And when we look at macro healthcare trends, we see that's also backed by changes in business models that are going on. So historically, healthcare companies stayed within their swim lane. They did what they did, and tech companies stayed within their swim lane, but we're no longer seeing that now. One of the biggest data collectors in the world is Apple, because they have over 200 million people around the world who have an Apple Watch. And they're therefore collecting daily information on an extremely large cohort of patients, or well, not patients, people. So you can see now that, and we've observed that, with other areas where you see these movements from an original area or expertise, technology, entering into new areas. And, as any VC will tell you, healthcare is the largest market in the world. And they're still waiting for the trillion-dollar healthcare company to come along. And it almost certainly will be a consumer-facing company that's managed to get people's interest and get them to pay in particular for services as well. And probably a slight add-on to that, one other major shift that we're seeing is the concept of healthcare as a single one point in time solution, like when you visit your GP or have to go to hospital for a specific issue, to something which is more as a service, and this kind of healthcare as a service concept, meaning more and more people are willing to pay a small amount every month, either to track their health or to have accessibility to a service through some form of retainer model. That's becoming increasingly prevalent around the world. And so we see the entire nature of healthcare changing from how many of us will be familiar with it being to what it's likely to be in future. And if we even look 10 years from now, that will become more normal, because the number of older people around will mean that healthcare systems will be forced to become acute care systems for the elderly almost exclusively. And then for everybody else, you either go privately or you manage your health really, really well to avoid having to go private. And you do that by kind of optimizing your wellness and lifestyle. So I think those markets will grow enormously over the next 10 years.
And one of the advantages of having this digital platform, it allows for that expansion to a much bigger audience and cohort. It doesn't limit you to just a small, you don't have to just go to your local GP. You can actually go to any expert anywhere in the world. And on that, Hassan, that aspect of allowing for that expansion, how have you seen, like, what kind of healthcare organizations have you helped to expand in that way using digital technology or any kind of tool that allows for them not just to access their local community, but much wider than that?
Yeah. So definitely on our end, Dr. Sarah, we see that a lot of spaces are fragmented. So if you're looking at these different verticals, the data sets are not speaking to each other. Rather, they're quite contained in their own vertical. So I think once you start linking up the data sets, if that's even possible, you could start connecting the dots and understanding further where the pain points are. How could funding basically be allocated to its best use in the healthcare system, and obviously train, whether we're talking about AI or other, machine learning, AI, whatever you want to, then would be able to start training these data sets. Because one thing I'm looking at on my end is, okay, you've got the UK and then you've got another market like the US, right? And it seems from my vantage point, and to a lot of people as well, that the US is much quicker at deregulating spaces just to be able to build on top of large data sets, whereby here in the UK, it's quite fragmented, again, as I mentioned earlier, across different verticals, and the data sets are not necessarily communicating. And that makes it very difficult for example, for people like us to come in and take advantage of already existing infrastructure and plug in our service, so we could come in and directly fund, for example, X or Y. So to answer your question outright, more centralization.
Yeah, I guess I asked that question because Imran was saying, that data gathering by these tech companies like Apple, it's a huge industry, and therefore this must mean that there's going to be a standardization of what we can access when it comes to healthcare, because we've got this huge database, and not just for one locality, but globally. So is that expansion to that stage still to happen?
Yeah, I mean, it's difficult to say, frankly, because there's going to have to be a lot of understanding between the different parties around regulation. But like, just speaking about Apple and all this data they're gathering, right? I mean, it's a no-brainer that this data would make perfect sense for an insurance company to get access to, right? Like Vitality, or like, so what if we got to a stage in the switch of a button, basically someone like Vitality can access all this data that Apple's gathering using your smartwatch, and redefine the premium that applies to you if you decide to take private insurance, right? So I mean, it seems to be quite fragmented right now. I know there was some conference in Europe around AI and globally regulating AI, but as long as everyone's doing his own thing, and maybe the Chinese and Americans don't want to communicate, and then the Europeans don't want to communicate with everyone else, you're going to have all these different regulatory bodies setting their own standards, and then you're going to have more and more friction. So going back to what Dr. Imran said, was supposed to be open source data, open AI, but it never really made it there. So
Yeah. If I can comment on that, I think so. Fragmented data is not new. It's been an issue forever in healthcare, but it wasn't really as much of a problem because there was very little data interoperability. But obviously, that's changing quite significantly on the specific aspect you mentioned of using healthcare data to kind of adjust premiums, for example. That's illegal in the US because of the HIPAA Act, but in Europe, it's not illegal yet. But individual, insurance companies can make that request, and if people opt in, they can use it for that purpose. But the questions then become complex and ethical, and that's something that needs to be considered as well. What happens if you have can they take your genomic data, or is it just your live data from a particular point? And so there's a whole set of ethical and moral issues which need to be understood. But your broader point that access to very large data sets will only be beneficial to spot macro trends and micro trends will be helpful is taken, because you see many companies now looking to either create data lakes or or the technology around monitoring unstructured data is increasing. Data is the key to all of this, because our large language models are only large because they're actually very bad at learning, and so they need colossal data sets. As DeepSeek showed, you can actually improve their ability to learn relatively quickly with lesser compute power. That's obviously something that's meaningful. But I think there's an element of what's likely to happen over the next 5 years, which is what we're currently discussing, and then kind of where things are going beyond that. And where things are going beyond that are going to be quite interesting, because I don't know who's on the call because I can't see the attendees, or perhaps even those who choose to listen afterwards. But here's an interesting thought for you all. Very soon, Gen Z and Gen Alpha will be entering the workforce. And Gen Z in particular will be becoming doctors very soon and practicing. And their attitudes to healthcare and their familiarity with technology is very different to most people that's on this call. And it's probably only a few years after that Gen Alpha will turn up and start being doctors as well. Their entire experience of the healthcare system in its entirety will be vastly different to us on this call. Their expectations will be different, everything from equality to their willingness to give their data and their patients' data into systems will be vastly different to ours. And a lot of the systems that will be developed actually for their expectations, because they will be the larger component of the workforce over a period of time. So although there are barriers and frictions at the moment into, for example, in data, but there are other areas as well, what we'll expect to see is a medical workforce, and of course it's not limited to doctors, who'll be far more happy to provide data to providers because they've been part of that digital universe and cloud universe from birth. And they'll be very happy to share that, and they'll expect to access their data, possibly their patients' data from anywhere in the world, and they'll be perfectly happy for it to be analyzed anywhere by anyone or any system, which by the time they're deep into their years of practice will be highly refined. And I think this then question leads to the question: what is the role of the doctor of the future? When even probably 10 years from now, there'll be free large language models, chatbots, where patients can simply talk into them, show them a picture of whatever area is offending them, because they'll be multimodal. They won't just take text as they do today. They'll take a combination of text, voice, images, and anything else. And these systems will be the best cardiologist, the best dermatologist, the best psychiatrist, behind a few boxes in a chatbot. They will probably give them an extremely accurate diagnosis, or at least a differential diagnosis, which really begs the question, given that most physicians' role is to diagnose patients and then, of course, create a treatment plan and communicate that effectively within the context of the patient, what is the role of doctors going to be in the future, particularly where we have aging and complex patients, and probably still likely to be under-resourced acute care system? And I think in that sense, the doctors of the future will be there to be the interface between the large language model or technology and the patient, who will say, well, this is what the model is saying, and this is what I think or I don't think. And I think, although that's not today's problem, for those who are interested in kind of considering the future of healthcare, this will be a very different way. And indeed, the patient's expectations of you as a doctor will be vastly different as well, because actually, on the intellectual side, they will know or have access to knowledge that you have, except they will have it with 100 years experience, while you will have it at maximum maybe 40 years experience. And so therefore that will change the entire tone of the conversation, the nature of expectation. And of course, we haven't even discussed the impact of robotics. And so you can see already that the world ahead of us is likely to be vastly different from some of the concepts that we're discussing even today.
Yeah. Yeah, I'm going to bring you back a few years, maybe like 5 years from now, because one of the things I was going to bring up is a current barrier is digital literacy. But like you've pointed out, very quickly that landscape is going to be changing. It has changed and is changing. And that particular barrier for that cohort is not really going to be of interest to most parts of healthcare industry. And we know that the data is all showing that people that access digital tools, that are accessing digital platforms and digital healthcare, there's a close link with using smartphones, using apps, using other forms of digital health behavior. There's a strong correlation with that, and that's obviously only going to increase. I think a lot of people are going to be thinking, and I know I've been thinking, why is it accelerating so fast? Why is this change happening at such a speed?
Yeah, no, and there's a very clear answer to that. And the answer is convergence. And just to paint a picture for you, when Henry Ford invented the motor car for the first time, now Benz invented it, but actually Ford made it cheaper for people and accessible. It didn't sell particularly well for the first number of years. And the reason why is because even though it was much cheaper and far superior to a horse, which was your alternative, or horse and a cart, the reason why it didn't take off is because the whole infrastructure wasn't there. Roads weren't built, petrol stations weren't built, there weren't lights in the streets at night time, there weren't garages, etc., to have your car repaired. It was only when those things gradually started coming into place you saw the huge acceleration of the motor car until, of course, it entirely replaced the horse and cart. We think about where we are today, we're a bit of a similar time, but except we have convergence of different factors. And the main factors that have caused all of this to happen now, and it's not just since November 22, which some people might remember as to when OpenAI and ChatGPT kind of came on the news and into most people's minds. It's because we have convergence of a number of factors, and some of those are technological, so AI, machine learning, but also genomics, also nanotechnology and quantum medicine has come at the same time as data has become far more interoperable, meaning that you can have data on a watch or your electronic health record, or digitized on a CT or MRI or any other form. And those are able to talk to each other. And then you have a change in business models where there's far more collaboration between tech companies and, for example, retail health. So you see that movement between different organizations who were initially in a single swim lane. Also, the people are willing to pay a lot more for healthcare as well. If we look at the GLP-1s, which everybody must be familiar with now, 90% of the scripts of those are by patients who pay for it themselves. It's not the healthcare system paying for it, which shows that there's a huge demand and appetite, pardon the pun, for people to pay for their own medicines. And then finally, we have this societal change as well, where there's a sudden increase of patients and people who want to see more equity. They want to see, for example, the impact of the environment. They're concerned about that with the medicines they take and the healthcare systems that they're in.
Imran, we've lost the audio.
Can you hear me? Yeah. Okay. So with the convergence of these four factors, we're seeing a sudden explosion in what seems like technology happening all of a sudden. It's not. It's just like the motor car happening when the roads are there, when the petrol stations and garages and laws, etc., are made in place. That causes acceleration. We're seeing that now, but this is quite temporal because this will last for a number of years, and adoption will be rapid because it is coinciding with an aging population, with huge demographic changes across most of the world, and we will see not so much an endpoint of this, but in every facet of technology we'll see deep acceleration, because AI is not a tool. And most people think of it as probably just like a search engine at the moment. But we must remember, AI is not a tool. AI is a creator of tools. And we've never had a product like that before, which is why they sometimes call it as something that's similar to a general purpose technology. So the way electricity is used in every single industry in the world, AI will be something similar to that, except AI is also often considered the brain of a robot that doesn't exist yet, but that robot's coming soon as well, coming very soon. Last year, or in fact, almost 1 year ago now, China announced their first entirely AI hospital. This is a hospital where the patient will come in and they use a type of AI called agentic AI, which is where the AI is autonomous. It can make its own decisions. And the patient will come in and speak to a chatbot, and the chatbot, upon listening to the patient, will guide it through, and the AI itself will select the tests that you need and the blood tests that you require. And even blood tests can happen robotically as well now. And then through getting the results of each step, it will then determine the next step and the next step as well. It's a research project at the moment, but it's the only one in the world. But you can imagine an agentic AI that takes, where AI can take the role of, 20, 40, 100 different staff members and make decisions itself, is something that's very appealing for the payers of healthcare and possibly to some patients as well. So you can see, although this might sound like something that's years away, that's already 1 year old, that hospital. Things
Yeah,
are
it does sound mind-boggling, because I think, with our current society, we can't imagine a world with that kind of autonomy for technology to have. But again, we've seen such a fast-paced change in innovation and technology being adapted. And I wonder, and Hassan, maybe you can comment on this. Do you think that, as the clinicians that you work with, the healthcare organizations that you work with, are they aware of just the possibilities that can happen? And what do you see your role in just this sort of innovation that Imran's talking about? That for me right now, it's just unimaginable.
Yeah. So on our end, maybe it's because we fund already established businesses. We're not seeing much of it being applied just yet in terms of AI and the impact of AI on their businesses. But I think if we were, for example, to fund startups, our current product's not good for startups, but if we were to develop a product for startups, I think we'd start seeing more and more AI-driven businesses. I mean, I was part of Entrepreneur First, an incubator program. I think 40-50% of the startups that come out of Entrepreneur First are healthcare companies. So that's where I've seen a major, if you want, the importance of AI in the healthcare space, because these guys are always pushing the frontier. So I would come into the accelerator program and see these guys all around me just developing different applications where they could take advantage and use AI basically to learn quickly how to provide the service. I mean, one really interesting point is also, to answer your question, is given that we're funding established businesses at the moment, we still haven't seen that transfer of knowledge into these businesses. But it's a no-brainer, frankly, because all the businesses we've funded are doing really well and growing quickly. Once they discover the advantages of AI in their business models, how much it's going to save in terms of cost efficiency, in terms of revenue generation, in terms of providing a better service to their clients. I mean, it's just a matter of time before we start seeing that. But one interesting point as well, just following up on what you were discussing earlier, Dr. Sahira, is life expectancy, right? So I was reading an article recently that I forgot who mentioned it, but he's saying AI and even quantum computing, once it becomes more mainstream, are going to increase the life expectancy of people by 2 times. It's going to double people's life expectancy in the next 5 to 10 years, I think is what he mentioned. And I'm just wondering, okay, if you're able to do that just because of innovations in medicine and being able to discover drugs quicker and different applications that you would know more about. But if that's the case, I wonder whether the system would be able to deal with the larger number of people given the limited amount of resources. So that's another thing that I mean, I found very interesting that, okay, you're using AI to make the world a better place, to reduce the time required to discover a drug to cure diseases or certain diseases. On the back of it, people's life expectancies are increasing. Then we come to a different situation where can the system cope with the larger number of people, literally. I mean, one aspect of it is, yes, it might be because also on the services side, you've got AI as well, and you've got these different service providers using AI to cope with a larger influx of people. But I found that very interesting in the sense that, okay, it's improving our lives, but at the same time, can we deal with the increased pressure on the system, if in fact it does create an increased pressure on the system?
I think a lot of the discussion we're having just now is without judgment on the ethics of it, because that's a whole conversation in itself, the ethical dilemmas of AI and healthcare and the life expectancy and all of these sort of things. But I think you've touched on, and Imran, you touched on this before, about the workforce crisis and how this can transform the need for actually having physical clinicians and physical staff members. And even if you look at the way the NHS is working just now, because it's under-resourced, because of the challenges people are facing, it can often be a not very happy place to work for many people. So how does something, I want to talk more about having a digital platform healthcare service. How does that transform, or how can that be a solution to the workforce crisis?
No, it has to be part of the solution, because the fundamentals are very strong. There are fewer and fewer specialists and doctors and nurses, etc., to look after an increasingly aging population. And Hassan, just to appease you, don't worry, that increase in lifespan is not going to happen in such a short time frame. Even to get to that doubling will take at least probably at least 50 years, if not longer. But the point remains the same. There will be burden. There's already burden. I think the kind of the great hope, and if you listen to Wes Streeting and Keir Starmer on their ambitions to introduce AI and make it easier to introduce it into the healthcare system, they clearly understand the potential that AI has to help a system that is certainly on its knees. And this is not unique to the UK. Every single market in the world, particularly where their state-funded healthcare systems are in a similar position, certainly in Europe, which is rapidly getting the nickname of the nursing home of the world, because aging population is a feature everywhere, and particularly in the West, but also other parts of the world. Most people don't realize, but India is going to have a problem with an aged population by 2050. There'll be far more people there that are older than younger. And that's odd for many of us who think of India as a very young place. China also is having a similar problem, although theirs is slightly different because of their enforced limits on children. And so this is going to be a global issue. It's already a global issue. In Japan, 30% of the population is already elderly. It's about 14% in the UK. And for the Muslim community in the UK, it's about 4% at the moment, but that's likely to increase. That's likely to double in a very short space of time. And all of us will need the support of digital technologies to make it easier, whether it's to help with loneliness, whether it's to act as a monitor because we can't all be home at the same time, or just to have people use baby monitors to sometimes look after elderly people as well. So we're already trying to use technology in the best way that we can to help us solve some of our challenges that we have to confront and manage. And so I think for most people, digital will be a welcome relief, particularly as issues such as privacy, issues such as making sure that data is confined and only used for a specific purpose that it was intended, and not for marketing or advertising or other purposes. And once there's reassurance that will happen, I think AI will become as expected in the healthcare system as an X-ray machine is today. Whereas once upon a time, there used to be concerns that these are not good things, they're too dangerous. But yet today we couldn't imagine a modern healthcare system without those technologies. So AI will save many things. It won't fix everything, and certainly it can't fix close to 2 decades of underfunding into a national system within the UK. But we don't have any better answers, quite frankly, and so this will have to be the best answer that makes the biggest difference.
And one of the other barriers that AI can overcome is the language barrier, I'm assuming, when it comes to, diverse communities.
I mean, it can. I mean, most LLMs are developed in English, and that's a bias for their inventors, whether it's the US typically or in some cases Europe. Obviously, most people will have heard of DeepSeek, which is the one that's come out of China recently. That obviously can do it in various Chinese dialects. But we expect to see more investments in local language models. So although large language models can translate quite easily, what they're very bad at is nuance and context. And because languages are so similar and so different in how they, sarcasm is, something that the Brits love, but it's less well understood in the States or even Australia or other English-speaking countries. So nuance that can't be picked up so easily by large language models. So the need to have language models that are based on or trained on a local dialect will be something that happens. And you're seeing that at the moment. Saudi has just announced an enormous large language model in the Arabic language for their patients over there so that they can make use of that. And no doubt you'll see other countries pursuing similar ambitions because language is an issue and this has the potential to solve it. But nuance is a bit more complicated for large language models to be able to understand.
I'm going to ask you a question that's come up in the chat to both of you. Actually, it's a really interesting one. How do Muslim healthcare professionals get involved in AI projects? What should I tell my daughter who's a medical student? That's a really good question. I think if we're thinking about the next generation, and Ryan, you alluded to this, the Gen Z, the Gen Alpha that have been born in this world. But how do we prep them for that world where they're ready to use AI in healthcare?
Yeah, I think for someone that's that young, I think they're using AI already, probably in their personal lives, whether it's just to compose an email or to search the internet or whatever, as many people are. I think the challenges and the directions that they should be looking for is where we know AI cannot answer things. So, for example, bias. AI is getting the bias in AI is going to become worse because of the way large language models are trained. So we need people who'll be able to identify those biases and understand that. Equity and equality is another issue within AI, and that's another issue. And then ethics, AI can say all sorts, but actually it doesn't have a moral compass. And so individuals or the human in the loop, as it's called, will still be required. And over the next 10 years, probably those areas of bias and transparency is another one, equity and ethics, and being able to make sure that AI is used in an appropriate way. These are all features which will be very, very important. So I'd strongly recommend for people that are still at university or even earlier, if they can find ways to understand either by doing courses, they need to understand AI models more generally, but that's hopefully gradually going to come into the medical curriculum. But certainly issues around ethics, bias, etc., those will always be there because AI will never have its own moral compass unless you imagine some sort of Terminator type situation where it's developed its own mind and its own context and its own world. But those roles will always be needed.
But Gen Z grew up with Terminator, remember, Imran? Hassan, can I ask you a question, maybe slightly different? How would you reply to that if the next generation want to be ready for this new world, digital healthcare world? How would you advise them?
So I would advise them, courses is one side of it. Another one is basically, I think they should figure out, if they already understand the aspect of healthcare they'd want to be involved in, then they should go and find an AI-driven startup that's really pushing the frontier in that space and either join it for an internship to learn more. They have to be in an environment where the culture is accommodating and open to questioning things. And there's no better place than a startup to do that. So they'd be able to get exposure to what's happening when it comes to AI in a way that might not restrict them going forwards, just because you're looking at most of these startups would have they wouldn't really have a lot of hierarchy, right? Or a lot of so whether it's here in the UK or in the US, I think the best way to gain exposure to this space, especially I know the young people, they love to join a startup. I mean, we get CVs all the time. Figure out someone who's doing something you really like in the healthcare space, and if it's AI driven, just drop them an email. They're always taking interns at the very least, if not figuring out a way to work part-time. And that's where the learning curve will be really steep, and they'd be able to learn a lot very quickly.
Thank you for that. Another question's come in. I think maybe more from Imran. Will AI be able to help curb down morbidity or mortality burden in maternity neonatal services due to understaffed NHS? Seems hard to imagine how.
Yeah, so I mean, the potential for AI to be used in any facet of medicine is there. So in most instances, the way that's been driven is typically by a startup that's taken an interest in an area. And that interest in an area is typically driven by the ability to access high quality data. So generally areas that have high quality data easily accessible tend to get the first sets of interest. Hence, we see it in radiology so dramatically, and also in digital pathology, because the data there is very easy to acquire, particularly very large volumes which are required for training. So in things like maternity services or mental health more generally, whether it's perinatal mental health or whether it's just classical adult or adolescent or child mental health, there are certainly opportunities there if the correct data sets will be made available. What I predict will happen over the next even 5 years is that a lot of startups that come up will vanish because the quality of the data was never good enough in the first instance. So the concept was good, but the data set wasn't good enough. And as a consequence, they fall because they're not providing the levels of accuracy or precision which are necessary for high stakes healthcare decisions. So what I expect to see is, the focus to be more on generating the data sets. So, for example, how can the NHS take some of its amazing data sets, which are fragmented, and those to be used for either the NHS to create something through one of its incubators or for a healthcare company to access it to be able to do it. So probably the right way to look at it is, where's the data set? Who can access it? For example, most people may not be aware, but one of the best multimodal healthcare data sets in the entire planet is in the UK. It's called the UK Biobank. And it's an amazing data set, so much so that some of the biggest outcomes that are looked for in AI and ML are validated against that data set. But it could be a lot bigger than it is simply because of the way it's set up. So it already has over, I think, 200,000 or 300,000 patients, and they have huge amounts of data on every single one of those patients, not just electronic health records, MRIs, genomics, proteomics, and a vast array of longitudinal blood tests. But it has a lot more than that as well, and it keeps expanding. The US is about to try and replicate it, something and even on a larger scale, but simply because of its longitudinal nature means it will take them a very long time to do it, whereas UK Biobank keeps growing. So look at where the data set is, and you'll probably see where the opportunities are, but ultimately it will be everywhere.
Talking about data sets, we've got a question coming from Najib Rahman, who's a consultant. He's an A&E consultant, and it's around the considerations within frontline NHS and that fact that they have large data sets, which are not always accessible to practitioners who don't have capacity to analyse, and additionally don't have means to connect with AI startups. AI startups don't always have frontline insight. How do we improve this nexus?
Yeah, I mean, this is a common challenge. And again, the Darzi report into the NHS in the UK and even West Streeting recognized the fact that we have colossal amount of data generally, but it's enormously fragmented. But it is sat under one NHS. So they're looking at ways to be able to bring that all together, harmonize it. But that will take time. But once it does happen, it will be an extremely powerful data set. Once it is there, and certainly in parallel with that, you can see a number of digital NHS initiatives that will look to see how they can utilize that data either through third-party providers or through themselves. In most cases, it will be third-party because it's not the job of the NHS to create new software. They can certainly license out the data, and of course, in a pseudonymized way, to make sure that those who want to invest in that risk have access to it, as they do with the UK Biobank, for example. But it's probably not their main job to actually create those new programs or risk calculators, etc. as well. But certainly the NHS has a better opportunity than most, and is already in a better place than most as well, although that might be difficult to believe.
Yeah, so I mean, again, Najib's pointed this out, that this will be beneficial in the future for future health issues, but maybe not for the real-time issues that we're having just now around health inequalities for today?
Yeah, it's unlikely. I mean, certainly for specialist areas like you mentioned, it won't be. Again, if you look to see where it is currently being used, it is in those areas that I mentioned at the start. So, improving operations in terms of, missed appointments. So the administration side, there's enormous opportunity. And some people might be familiar with how that's being used at the moment. Even if it's just, hiring people, you can see AI being used quite considerably there. But of course, where it makes a clinical difference directly is, again, in supporting diagnoses, for example, and helping you understand what you might have missed. So the concept that when you're sat in front of your computer, the computer's listening to what the patient is saying, and it has all the knowledge of that particular patient's healthcare record, and it is giving you a live running stream of what this issue might be, and simultaneously suggesting which tests that you should organize and arrange. And in future, you'll be able, that will be automated as well. So it will go ahead and make the referral itself with all the patient data in there. For today, though, the best you can probably do is have a scribe, so at least you can drag and drop into your electronic health record, EMIS or whatever. But so that's probably as far as it's going today, because there are a number of different privacy issues that need to be sorted out there. Some systems will not allow the use of Heidi or other similar such scribes. But you can see where the direction is going, and it might only be another year or so where it will make a big difference. Obviously, in terms of radiology reporting, that's already happening. Pathology reporting, that's already happening. Possibly most people aren't even aware that it is happening.
Yeah, I think some really exciting times ahead, some really interesting insights being shared today. And we're actually coming to the end of the 1 hour webinar. And I think to summarize, I think it's really one of the advantages of all this is that healthcare will be more accessible and more cost effective. We will have access to experts and a variety of sources at our fingertips. Quicker, cost effective, more equitable, and it breaks down those barriers that we're now facing and the challenges that we're having. It can be the solution to that, and I hope that we can navigate this in a ethical and equitable way. And so just to end, I'd like for both of you to say in a few sentences, say why the future of healthcare is positive, and give me one example why. Imran, if you go first, and then Hassan.
I think the future of healthcare is positive because it has the potential to solve some of our biggest challenges at scale. And I think that's very exciting, and it's much needed. Probably the thing I'm most excited about is how, as Muslims, we understand limits and what safeguards we need to consider to put in place to avoid AI from acting like God, which they'll never have obviously that specific capability, obviously, but it may have elements where we need to have a considered approach and a thoughtful approach of how do Muslims as a community and Muslim doctors want to utilize some of these new technologies and opportunities that will be available for us. So I think that's something for all of us as a community to think about. But the future, nonetheless, is exciting because technology is exciting.
Yeah. Yeah. So all these tools are coming up, and technology is enabling us in so many different ways. I would say as long as it's used with the right intention, and especially when it comes to Muslims, when our faith and technology overlap, I think then we might see miracles happen, and that's why I'm so interested in what's to come. Obviously, inshallah, as always. So if Allah wills it, but we've only seen that in our religion, that our religion encourages progress. So this is progress, and in the right hands, I think we're going to see great stuff happen by the will of Allah.
So in conclusion, we must take this as an opportunity with both our hands and be in the driving seat of it, and not, kind of feel that it's something that's not within our capacity, or try to ignore it because it's here, it's real, it's changing the face of healthcare and and society at large. Imran, thank you. Hassan, thank you. It's been a pleasure having this conversation and sharing the space with you. And I'll see you both soon, inshallah. Assalamu alaikum.
Wa alaikum assalam.